Hello friends, so this is informational videos for parents who came with a child with a foreign body and nose. So any child who's taken foreign body in ear, nose, throat, you should visit the nearest ear, nose, throat specialist, an ENT surgeon. And you should never try to remove it yourself, as it can cause a lot of complications. So what are the complications it can cause? So if you try your local methods, you use something, pen or something, you push it inside, and you can also cause local trauma, bleeding inside the nose, nasal cavity, and it can lead to a lot of edema, and it can be pushed anywhere. So different kinds of foreign body, small, big, sometimes it can slip behind the nose into the nasopharynx or the airway and or the food pipe. So if it goes into an airway, it can lead to choking of the child, cessation of the breathing, which is stopping of the breathing, and that can be a real big complications. So you should always try to avoid doing it yourself, or sometimes even local practitioner should not try this, because it can lead to a lot of complications, and then removal of foreign body becomes really difficult. So I will suggest always visit an ENT surgeon, get it removed by him. They are trained to do it, they have the instruments, they have the techniques how to remove it. Many times we will remove just child sitting in a parent's lap, and we'll just remove it if it's not too much inside, if there is not much of the trauma. So it's much easier for an ENT surgeon to remove it. Sometimes it can be a complicated case. In this child, it came with after 1 day, and then there was a lot of discharge nearby inside the nasal cavity. So and it was little bit inside, it was pushed, so it was little edema, swelling. So we have to take care while removing it. After under headlight, under proper visualization, after suctioning all those areas, swelling, edema was seen, and then the foreign body was visualized, and special care was taken that head end was little elevated so that it doesn't fall back while removal. And then we removed it with a special instrument made for this removal of the nasal foreign bodies. We removed it successfully without any trauma to the nose, and parent was happy. So I will just suggest, if you just don't panic in these situations, don't run here and there, get an ENT surgeon consultation. They will remove it much easily. And if you complicate it, sometimes they had to put the child under general anesthesia, and the general anesthesia has another risk. So you should always avoid doing it yourself, and even local practitioner should not try it, and send it to the ear, nose, throat specialist. Thank you very much for listening to this video.